So do your abdomen look like this? So you have a lot of loose skin, so you are bothered to wear the dresses, then abdominoplasty or the tummy tuck surgery is the answer. So I am a plastic surgeon, so we do a lot of abdominoplasty surgeries. We can remove the fat with the liposuction, we can cut the hanging skin and give you a very good physique or a figure you always desired for. So you might have many queries, many doubts, so you can watch this video on the abdominoplasty till the end. So all your queries will be answered, and I advise you, we keep on posting such videos on the YouTube, so you can subscribe our channel and hit the bell button so you get the notification for the new videos. What is abdominoplasty? So abdominoplasty is a plastic surgery procedure which is designed to remove the excess skin and the fat from the abdomen, so it can tighten the weakened muscles. So it is condition called diastasis recti, and finally it can improve the appearance of the midsection, creating a smoother and a firmer contour. So it is popular among the people who experience the significant weight loss after multiple pregnancies, natural aging. It all leads to excess skin and the weak abdominal muscles. So what are the types of the abdominoplasty, also called the tummy tuck? So first is the full abdominoplasty. So it is best for those with the excess of the skin and the fat both in the upper and the lower abdomen. It involves a horizontal incision from hip to hip just above the pubic area, and a small incision around the belly button to reposition it. So it also tightens the abdominal muscles. Second is the mini abdominoplasty. It is ideal for the individuals with the minimal of the skin laxity and the fat which is below the belly button. So it involves a shorter incision in the pubic area, does not require repositioning of the belly button. It is less invasive than the full tummy tuck. So who is a good candidate? So you should be in a good overall health and with a stable weight. So you should have a loose skin, muscle laxity which is not being corrected by the diet and exercise. If you are planning for significant weight loss or future pregnancy, then you should avoid the tummy tuck for a later date, and you should be a non-smoker or willing to quit the smoking. Surgical procedure. So preoperative preparation. So first is the consultation. So consult a plastic surgeon with a detailed discussion. All your queries should be answered, and a checkup for your medical history, the lifestyle, and what desired outcomes you want. So what are the pre-surgery instructions? So you should avoid smoking for at least 2 weeks before and after the surgery, and you should discontinue the blood thinning medications as aspirin, and there should be someone to assist you post-surgery. So what are the surgical steps for the tummy tuck surgery? So first is anesthesia. So it is always done under general anesthesia. Where is the incision? The surgeon makes an incision based on the type of the tummy tuck. So it is in the lower pubic area. And third surgical step is the muscle tightening. The inside there are abdominal muscles which are tightened that might have been loosened. So cutting of the excess skin. So in the lower abdomen there is the hanging or the loose skin. So your plastic surgeon cuts the extra skin. Then removal of the fat. We do liposuction in the upper, the lower, the love handles, or 360-degree liposuction to give you a very good contour. So liposuction is always done with the abdominoplasty. And fifth point is the belly button repositioning. For the full or the extended tummy tucks, the belly button is relocated to align a newer abdominal contour. Last is the closure of the incision. So it is closed with the sutures or the adhesive tapes or the skin glue, and there might be a drain for few days. So duration of the surgery, it typically takes around 3 to 4 hours for the complete lipo-abdominoplasty depending upon the complexity of the procedure. So what is the recovery process? So we divide into immediate post-surgery and the late recovery. So immediately after the surgery, you will be worn a pressure garment that will minimize the swelling and it will support the abdomen. So there might be the drainage tubes which are placed to prevent the fluid buildup. Pain, swelling and bruising are common, which are manageable by medication for around 1 week. So recovery timeline, so 1 to 2 weeks you will be doing light activity and swelling and bruising is at the peak in the first few weeks and it begins to subside after that. Then 3 to 4 weeks there is a gradual return to the normal activities, but you should avoid any strenuous exercise. Then 6 to 8 weeks, so most of the swelling has resolved, you can resume the exercise, and at the time of 3 months the final result will be noticeable as the tissues has healed completely around 3 months. So post-operative care, so avoid heavy lifting for 6 to 8 weeks. So you should sleep with your upper body elevated and the knees slightly bent to reduce the tension on the incision in the lower abdomen. So what are the benefits of the abdominoplasty? It gives you a smoother, firmer abdominal contour. It improves your posture by tightening the core muscles. It addresses the diversification of the recti muscle, improves your core strength and functionality. It will boost your confidence, particularly after pregnancy or weight loss. It can also reduce the skin irritation or rashes if you have a lot of loose skin, hanging fold of the skin in the lower abdomen. So what are the risks and the complications? So while it is generally safe, but abdominoplasty has some potential risk. So first is the seroma. So there can be fluid accumulation under the skin, which is managed by the drainage. Infection, it is rare, but proper care must require the regular antibiotics. Then the blood clots, it is rarely but a serious complication of called the deep vein thrombosis. So we advise you to be mobilized from the day one. You should be walking around. Then the scarring, there can be a scarring, varies from person to person, but every plastic surgeon is trained to give you a minimal of the scar and proper follow-up with silicone gels to avoid bad scarring. So poor healing, if you are a smoker or certain medical conditions, there can be poor healing. And numbness of the abdominal area, it is temporary for few weeks. The sensation is normal after 6 to 8 weeks and is best at 3 months. So what are the commonly combined procedures? So for comprehensive body contouring, abdominoplasty is often combined with liposuction. So liposuction is removal of the fat to sculpt your waistline and to get rid of the love handles, to give you a very good contour at the lower back. So we always do the liposuction, which removes the localized fat deposits, and I always prefer the ultrasonic liposuction. Second thing is the breast surgery called the mummy makeover. If we do the tummy tuck with the breast lift, it becomes the mummy makeover. So breast surgery in the form of breast lift or breast augmentation or the breast reduction is often combined with the abdominoplasty. And third is the body lift procedures, maybe a brachioplasty, arm lift or the thighs lift, especially in the patients who had undergone bariatric surgery and there is a lot of loose or hanging skin. So we can combine abdominoplasty with the thigh lift or the body lift. Thank you.